Hello and welcome. Today we're talking about something that's, well, deeply personal for millions of families, and that's dementia care. We're going to look at a complementary approach that reframes not just the symptoms, but really the whole experience of being a caregiver.
And that right there, that's the moment that just captures it all, doesn't it? It's a turning point that so many caregivers know firsthand. But as we're about to see, the day-to-day reality of caregiving goes way beyond just these painful moments of non-recognition.
You see, the story of dementia is almost never just about memory. It's really more like a whole constellation of connected challenges that can completely throw off the rhythm of daily life for everyone involved.
I mean, think about it, right? The sleep is broken, which of course leads to exhaustion. Frequent trips to the bathroom at night mean no one is getting a full night's rest. Then you've got low energy, feeling cold. It's all signs of a system that's just struggling. And what does it all lead to? Well, profound caregiver exhaustion. These aren't just separate little problems. They're all part of a larger pattern.
So, what if we looked at that pattern through a totally different lens? The source material we're digging into today introduces a framework from traditional Chinese medicine that offers a pretty unique way of seeing how all these symptoms might actually be connected. Okay, so at the very heart of this way of thinking is a concept called the kidney-brain axis. Now, it's really important to get this. In TCM, when they say kidney, they're not just talking about the organ. They mean a whole energy system that governs our core vitality. And this system is seen as being directly tied to brain function, to sleep, and even to things like bladder control.
And this slide really lays out the difference in perspective. So on one hand, the conventional view might see memory issues, sleep problems, and bladder troubles as totally separate things, right? Each one needing its own fix. But the TCM view suggests they might all be coming from one single root cause, a depletion of that core energy along the kidney-brain axis.
Okay, so that's the theory. But how does this actually translate into something practical, something a caregiver can use? Well, the source introduces a method that's, remarkably simple and based on these very principles.
It's a 100% external herbal pouch, and the key word there is external. It's worn right at the navel, and this is huge, absolutely nothing has to be swallowed. For anyone who's been in a caregiving situation, you know that can be a really big deal.
And the routine itself? It's really designed for the reality of being a caregiver. The caregiver just applies the pouch. It's worn non-stop for over 3 days. And 3 of these pouches make up a full 9-day cycle. It's this steady, gentle routine that's meant to just easily fit into your life.
And this brings us to a really powerful number, 0. That's 0 pills for the patient to have to remember to take, 0 struggles over swallowing. I mean, that detail alone is just so significant because it gets rid of a huge source of stress and confusion, making the day just a little bit simpler for everyone.
So you're probably wondering, what did caregivers actually see when using this? Let's get into the evidence presented in the source. But it's really, really important to be clear here. These are preliminary findings. They're meant to offer some insight, not to be definitive proof. First things first, and this is crucial, the source is very clear that this is a complementary support method. It is not a cure, and it's definitely not a replacement for the standard medical care prescribed by a doctor. Its job is to support the patient and the caregiver alongside whatever treatment plan they're already on.
So these observations we're talking about, they come from a small retrospective case series with 11 patients. And the outcomes weren't measured in some lab. They were reported by the family caregivers, the people living it day in and day out.
And the pattern they reported is pretty interesting. A lot of times, caregivers said they first noticed improvements in the foundational stuff, like better sleep or fewer nighttime bathroom trips. And from there, some families started reporting improvements in recognition, in social engagement, even in mobility, all things that helped lighten that overall caregiver burden.
And again, just to be totally transparent, the source is clear about the context. This is preliminary data. It's from a small series looking back at past cases. It's not a big, randomized clinical trial. And so we have to look at the findings through that specific lens.
So when you put all of this together, what's the real goal? It's maybe the most meaningful goal for any family dealing with dementia. It isn't about reversing the clock, but about making the present just a little bit better.
This quote really captures the entire spirit of this approach. The point isn't to create a bunch of hype or promise a sure thing. It's about the gentle, hopeful possibility of just creating more good moments. A calmer night's sleep, a shared smile, maybe a flicker of recognition. These are the small wins that mean absolutely everything.
And that leaves us with one final question to think about. On a journey that is so often incredibly complex and overwhelming, could an approach that's all about simplicity actually be the thing that matters most for improving the quality of daily life?